Good afternoon, everyone. It's Wynn Brown with Heywood Healthcare's weekly update for staff and for the community on Friday, the 7th of January. It's been an incredibly busy week at Heywood, probably one of the busiest and most challenging we've had since I have been there, and probably all the staff have been there, but we've done an admirable job. I'm really proud of the staff. I've been rounding regularly and thanking them for the great work that they're doing in the midst of this surge, which quite honestly is a bigger challenge than any of the surges that we have seen so far for multiple reasons. But just to give you a sense of our testing, so far we've tested 135,000, almost 136,000 specimens for COVID-19 since the start. Our cumulative rate of positivity is 7.3, almost or more than twice the state at 3.27. Our 7-day positivity average is 29.53%. A good 8% higher than the state at 21.62. Remember, the positivity rate that we're reporting really is our testing, and there are people that get a rapid at home and know that they're positive as well. So those don't show up in the numbers, so they're underreported. There's some charts and some graphs. If you look at the timeline that goes from the beginning of the pandemic to now, you'll see that where we are on positivity outstrips us in the past. So you get to see we're at almost 139 per 100,000, up 45.6 points since my report last Friday of positivity. We are off the charts, everyone. So we had 29 inpatients as of this morning. I don't know, we may have discharged or taken in some other patients, but we have 29 inpatients in the system right now, and I'm sure we have some other patients under investigation waiting their lab results. So just a special note to all the staff out there who are doing an amazing job, and we can't forget Payroll and Finance, who are working 7 days a week in many areas, to not only to make sure that we're paying our bills and collecting our revenue, but we are on Kronos manually, and that takes an incredible yeoman's work to get that done. If you've been watching the news, there are other academic medical centers across the Commonwealth that are getting bad press because they aren't paying people on time or they're not paying them correctly. So just a huge shout out that, little Heywood Healthcare does the right thing, and we're doing our best to do that. Also, if you've been on the Heywood campus, you've noticed the National Guard, and it's fantastic to have their support. I am also happy to report that we are going to be having monoclonal antibody service starting on the Athol Hospital campus next week, which is a fantastic service to bring to our region. We've been working with the state on that, and we'll be able to provide that service to people who have been positive with COVID, who need that service to help them mitigate their symptoms and recover faster. And also a shout out to Mayor Mike Nicholson, who was incredibly supportive of healthcare in our region, and City Council President Lizzie Kaczynskis for their inauguration last evening, which was a great festivity. Everybody was super safe as well, so I don't expect a surge out of that. We had the Gardner Middle School chorus. That's phenomenal. The cheerleaders were there. The governor came. Really, in the midst of some dark hours, a celebration of some of the things that are good in our community. Speaking of things that are good in our community at Heywood, starting on Monday, we will begin providing free meals for staff again. It's a huge lift for our food services because of being understaffed, for challenges in recruiting staff, for staff who have left, and then the COVID positivity where staff are out for a period of time as well. So thank you to the food service on both campuses. There's a memo that is going to be coming out to staff so that you can see what we're going to be doing there and what sort of the guidelines are around that. We will also be providing food to our off-campus Heywood Medical Group practices as well. I hope you have a fantastic weekend. Thank you to the staff who are working on this weekend to take care of everyone. Thank you to the leadership team who will be meeting twice a day via Zoom over the weekend to make sure that we manage the flow through the house and tackle any challenges we might have from a patient flow perspective, from a materials, from an equipment perspective, to make sure that we can care for our community as we really live on the edge of our capacity right now. So thank you all. Have a good weekend. I'll report out to you soon. Take care.